Hey, everybody. Welcome to 7 Minute Health Chat with Robin and Kim. And today we're coming at you a day early because our special guest today, Lara Uher, is going to talk all about mental health with us. And the month of May is Mental Health Awareness Month. So we didn't want to let May go by without touching on this subject, especially from the things that just happened recently, here in the United States. So Lara, I'd like you to introduce yourself, tell us a little bit about what you do, and then maybe we're going to ask you a few questions.
Awesome. Thanks, Robin. So I'm Lara Uher. I'm a licensed independent social worker. So I've been working in the field for about 20 years, primarily in school districts. I work with students with special needs, working on improving their quality of life in school and family, the home life at home. And then I also am I have my own private practice kind of thing. So I see clients kind of in a therapeutic type of setting, and I provide all types of therapy. My main area of focus is brain-based interventions. So I work a lot with neuroscience and therapy on kind of trying to yield the best outcomes in terms of the brain and how we can change the brain to support well-being.
So how do you?
Now that's, sorry. No, go ahead, Kim.
So the brain, is that just through kind of talk therapy sessions?
Well,
you have certain protocols for that?
We definitely have certain protocols. It all involves mindfulness. I mean, mindfulness is something that proves to change the brain. I work a lot using Dr. Dan Siegel's work and polyvagal theory. It has a lot to do with the central nervous system and how we can provide coping strategies to get my clients and whoever I work with, and it's called the window of tolerance. So we really want to widen that window to take care from a mental health standpoint and physical standpoint. So we kind of weave the two together.
Okay.
My question is, so some people are born with different genes or whatever chemical imbalances in their body, correct? And so is that kind of what you help with, like to fix that, or?
Well, studies and research shows that there is a genetic component to mental health, as well as an environmental component. The difficulty is we cannot weed out what is really impacting our mental health. It's all interconnected, but we really can't weed out and highlight and investigate what specifically has kind of perpetuated an onset of mental health conditions. So it really is looking at mental health and physical health from a systemic standpoint, very holistic, because anything that improves mental health improves physical health and vice versa. We cannot separate the two. Mind and body, they're connected.
Gotcha. Yeah. So if you could give us like 3 to 5 different things that we could use to improve our mental health or to help other people like that are needing help.
Well, I always like to highlight the 3 R's. This is a research-based way of alleviating anxiety, and it's routine, relationships, and regulation. So when we look at routine, any type of predictability or kind of sameness supports relaxation, supports kind of us feeling safe and secure. So whenever we're looking at alleviating anxiety, we focus first on routine. It's a very basic, very easy and simple way of kind of approaching anxiety reduction. And then we lead into relationship building. So all social support networks is probably the most beneficial coping strategy, is having a support network. And it doesn't mean family, it could be friends, it could even be pets. So when we look at alleviating anxiety and improving mental health, relationships and connection that's essential. And I always, whenever I'm training anybody on mental health or providing education, I always stress that there's certain themes in mental health, and relationships and connections is a primary theme. You see that throughout all the modalities of therapy and any type of intervention, we focus on connection. And I also want to highlight another area of interest is compassion, and how we can practice compassion for ourselves and others. And there's 3 dynamics with compassion, and one is mindfulness. We always have to be in the moment. If we're living in the past or the future, then that creates a lot of really difficult negative feelings and thoughts. But if we're in the present moment, that's where we can do, that's where the magic happens, is being in the moment. So then we also focus on relationships with compassion. We have to feel connected. We have to have a sense that we're not alone. That's essential. Like the moment we feel like we're alone, then, you know, we suffer. Yeah. Not just internally, we suffer in relationship to each other. So really highlighting that we're not alone, that people, everybody feels, everybody struggles with their mental health at some point in their lives, and it's so important that we need to connect with others, because that's essential in supporting our mental health. And then
not be embarrassed of that too, right? And not be embarrassed of that. So that
exactly. The stigma, mental health stigma, is the #1 kind of barrier to getting support and help, and how it's so important to really identify and embrace the concept that it is okay to ask for help. Like, you are not alone. And then that's a sign of strength. I think that many people kind of struggle with feeling vulnerable and weak, but that reaching out for help is a sign of strength. So then that third thing, I don't want to kind of forget about this, I think is very important with compassion, is just feel a very warm sense of, or kind of conveying or cultivating a sense of warmth with ourselves and a caring sense for ourselves and others. That's like the third component to compassion.
That's awesome.
Right.
Yeah. And so the other question I would have is, let's see, let me look at my statistics. Like, when you were talking about connection and compassion, I mean, I'm sure, and if you work with children, like the past few years have just been horrendous.
It's horrendous.
Yeah, like, how do we come out of this? Like,
I feel like as a collective whole, we have to be here for each other. And we have to recognize that we'll never go back to the way we were. You know, COVID changed us, and all this violence in our country now is changing us. So we can't go back. We just have to look forward. We have to embrace the concept that we are not alone. I keep repeating that because I feel like that's so powerful. Yeah. And it's such a basic concept, but the moment we feel alone, that's when we start having symptoms of depression, is that we feel alone, we isolate ourselves. So connecting with each other is extremely important to protect our mental health. And I also want to highlight that just because we might be struggling with our mental health does not lead to the notion that we have a certain mental illness or condition. We can have poor mental health, but not have a condition. And we can have mental illness, but have periods of mental health, like really solid moments of health and wellness. So I want to also highlight that it's
and
okay.
Don't you think people label a lot? I mean, and that's what you want to kind of stay away from, is the labeling.
Right. For sure. But also labeling it helps tame it. So we have to name it to tame it. And I think that that's really powerful. And sometimes people come to me and they're like, oh, I'm having all these symptoms. They might not call it symptoms. And it's just a very confusing time for them. So then we kind of identify criteria, we put like a name to it, and then we work on taming it by naming it. And that, then they can like really target services and target coping mechanisms and things like that, which I think is really powerful.
Okay.
Right.
Good stuff.
And so I know you had a handout, or not a handout.
Handy dandy fact sheet.
Yes, that you kind of wanted to go over.
Right.
So I'm going to put it in the comments when we're finished.
Okay,
But can you
awesome.
just tell them what it's about? And this is kind of what it's going to look like in the comments.
Right. So this is highlighting more so for young adults, the statistics of mental health, like 1 in 4 young adults experiences some sort of mental health condition. Anxiety and depression are the 2 highest mental health conditions kind of currently. It kind of fluctuates. Anxiety disorders are typically the highest diagnosed. I think, and sometimes I think it's because it's easier for us to talk about worries than fears.
Mm.
And depression goes into like a lot of fear and sadness. And so I think anxiety is a condition where people feel more open with discussing their concerns or their experiences. It highlights, which we already mentioned, that there's an environmental and a biological component to mental health and how that develops in everybody or in people. Also, it does highlight, which we already talked about, the stigma, that is the like #1 barrier of getting mental health support is the stigma surrounding that. I honestly think that post-COVID, there is more conversation around mental health. Like I can't go into my newsfeed without seeing something about mental health. And I'm just so happy. I'm so actually grateful would be the better word for that it is out in public now, because for years people have suffered in silence, and I still think that is going on. But the more we're having a conversation in the media, the more we're having conversation in families and friends, the more likely that people will seek support. Having said that the wait list for mental health support is astronomical. Like anywhere you go, there is always a wait list. So there needs to be, better care in terms of funding and things like that, because we do need to have more availability for people to access resources.
For sure. So where can people find you if they're looking and they're listening to this and they're like, man, I love that Lara, I got to talk to her.
I actually work through, it's called Wellness Collective. It's a wellness organization in Columbus, Ohio, that really targets organizations, businesses, and their wellness program, which is amazing. So we're really dealing with mental health in the workplace and how phenomenal that is for people to have support at their place of work. So that's my primary area of kind of focus right now, is corporate wellness. But I do have a private practice feature of my job where I do see clients individual and group based.
And so are those mostly youth, children, or adults too? I mean, any age you see
any
privately?
Age.
Okay.
I always highlight that geriatrics is not my area of specialty. Like I typically have worked with, kids and young adults, but yeah, pretty much any age.
Okay.
No, thank you. Yeah. A lot of good
All
info.
right. Awesome. Yeah, we are over 7 minutes, but that's okay.
I know, I'm so sorry.
No. We need to call this like 10-minute health chat or
right.
15.
8.5.
Kim and I are looking at changing the name of it.
Thank you so much, Lara. This was
thank you.
beneficial.
Yeah, and
Awesome.
then maybe can we put your information where you can
Oh,
be
yeah.
contacted, like
For
in
sure.
our comments? Okay, very good.
For
So
sure.
we'll do that. And
also, I'm going to put in some lifelines and resources in terms of crisis hotlines. I think that there can never be enough information if you ever need to reach out to somebody.
That's awesome.
Perfect. Well, thank you so much for speaking with us today. We really appreciate it.
Thanks so much for having me.
We'll see everybody later.
Take
Bye-bye.
care.
Bye-bye.
Bye.